In the corridors of Al-Shifa Hospital, exhaustion is everywhere. A young nurse, pale and unsteady, collapses from hunger. Her last meal, a scrap of bread shared with colleagues. Her co-workers rush to help, but there's little to offer. A sip of water, a comforting hand. This is daily life for Gaza's medical staff, who work on empty stomachs, pushing their bodies to the brink. Surgeons operate with trembling hands, nurses faint mid-shift, and doctors describe themselves as ghosts walking these halls. They give their food and water to patients, sacrificing their own health for others. Across Gaza, medical workers are the last line of defense, but that line is breaking. The psychological toll is immense. Hope is as scarce as bread. They comfort grieving families while battling their own hunger and exhaustion. Every day, they witness suffering they cannot stop. The constant stress and malnutrition create a perfect storm of burnout and trauma. These are not just healthcare workers, they are witnesses to a catastrophe. Their dedication is immense, but dedication cannot fill an empty stomach. The war has forced them to choose between their own survival and their patients. They are fighting not just a war, but a war against hunger. And it's a battle they are losing. In a makeshift neonatal unit, a newborn named Fatima cries, a weak sound from a body already wasting away. Her mother, Amal, is too malnourished to produce milk, and the hospital has no formula. Staff try to dilute cow's milk, but it's dangerous and nearly useless for infants. This is the reality for thousands of babies in Gaza, hunger from their first breath. Infant malnutrition has soared, with dozens of children dying from starvation. The lack of clean water and power means even rare formula can't be safely prepared. Nurses face impossible choices: risk infection with unsterilized bottles, or let babies starve. Over 18,000 children have been hospitalized for acute malnutrition. Survivors face lifelong health problems, stunted growth, weakened immunity, cognitive delays. The under-5 mortality rate has more than doubled. For Gaza's children, the fight for survival begins at birth. Hunger is their first enemy. Hunger and thirst are silent killers in Gaza's hospitals. At the Indonesian hospital, patients risk dying not from wounds but from lack of food and water. Medical staff skip meals, their own health fading as they try to save others. Dehydration complicates treatments and makes recovery nearly impossible. Without fuel, water purification fails, and people drink contaminated water, spreading deadly diseases. Life-saving medicines spoil without refrigeration. Incubators and dialysis machines sit idle. Over 70% of Gaza's hospitals are damaged or destroyed. But for those still open, the lack of supplies is the final blow. Patients with chronic illnesses can't get basic medications. He survived the bombing but may die for lack of a pill, one man says outside a depleted pharmacy. The blockade turns treatable conditions into death sentences. The war creates the wounded, but hunger and thirst finish the job. These are the invisible weapons of this crisis. This is not a natural disaster, it's a man-made crisis. Gaza's borders have been sealed since October 2023, with strict controls on food, water, medicine and fuel. Humanitarian aid is systematically blocked. Convoys wait weeks at the border. Hundreds of thousands of pallets of aid are stuck, while arbitrary inspections reject critical supplies. The UN's main aid agency was banned, and other organizations face endless bureaucracy. Even when aid gets through, destroyed roads and constant airstrikes make delivery perilous. Amnesty International has documented people killed while trying to get food. The system is broken from border to bedside. The result, a manufactured famine unfolding in plain sight. Gaza's shelves are bare not by accident but by design. Starvation is being used as a weapon. The numbers behind Gaza's crisis are a collective scream for help. Over 44,000 have died, but malnutrition and disease claim more lives every day. At least 66 children have died from starvation, likely an undercount. Maternal mortality has doubled. Women give birth in shelters or rubble. The entire population faces acute food insecurity. The International Court of Justice has ordered Israel to allow aid, but human rights groups say starvation is being used as a weapon. Over 70% of hospitals are non-operational. The under-5 mortality rate has soared. These are not just statistics, they are lives lost to a system that has failed the most vulnerable. The crisis is an indictment of our collective inaction. The world sees Gaza's suffering, but action lags behind outrage. The UN and aid groups call for a ceasefire and unimpeded aid, but legal and diplomatic efforts move slowly. For starving children, delayed justice is no justice at all. Political maneuvering and new conflicts distract from the urgent humanitarian crisis. Images of fainting nurses and starving babies spark global protests, demanding an end to the blockade. The public's voice is powerful, pressuring governments to act. Yet the question remains, will this pressure bring real change before thousands more die? The lives of civilians are caught in a conflict with no end in sight. The world is watching, but watching is not enough. Action is desperately needed now. Even in darkness, hope persists. The first step is a permanent ceasefire and open borders for aid. This is not charity, it's a matter of law and humanity. Around the world, people are organizing, donating, and demanding action. Activists risk everything to deliver aid, sending a message: Gaza is not forgotten. You can help. Stay informed, share the truth, support trusted aid organizations. Every act of solidarity matters. Hope lies in the courage of Gaza's doctors, the resilience of its families, and the compassion of people everywhere. The path forward is hard, but not impossible. A future where Gaza's hospitals heal, not hunger, is within reach. If the world chooses to act, hope can become reality.